UW360 is proudly supported by Pacific Office Automation, copy, print, workflow, and IT. Problem solved.
It's a unique global and collaborative approach so that those with spinal cord injuries regain some mobility. And a team at the University of Washington is at the forefront.
In 1995, actor Christopher Reeve was thrown from a horse, and he suffered a paralyzing spinal cord injury. He soon became a beacon of hope for patients and the medical community by advocating for stem cell research.
Chris was very inspiring, but I think the timing just wasn't quite right. I think now we're really approaching a time when things can be done.
2 decades later, Dr. Phil Horner, a professor of neurological surgery, is taking a unique and groundbreaking approach to improving the lives of quadriplegics.
When people think about spinal cord injury, we often think about making people walk again, and I always thought that was really the main goal. But in the last few years, we've set a very specific goal, and that goal is to try to use a very select approach to try to improve hand function in people who have paralysis. Just a little bit of improvement in hand function is really enabling for a person who has quadriplegia.
To improve hand function, Dr. Horner and his team are combining 2 proven therapies, stem cell therapy and stimulation.
Our sort of light bulb moment was, why don't we bring these 2 technologies together? We get some improvement with physical therapy or stimulation, and we get some improvement with cell therapies. How will they work together? This is 6 months after injury, right, in this particular sample.
Dr. Horner is already seeing promising results.
What stimulation does is it coordinates the activity of the brain cells that are still connected with the spinal cord. We kind of get these 2 systems talking again. We think when we do that, in the presence of cells, this period of plasticity will really lead to improved hand function.
I have hand function issues. My hands don't work as well as I wish they would, especially my right hand.
A skiing accident 13 years ago left 58-year-old Bruce Hansen paralyzed from the chest down. After years of intensive physical therapy, he can now walk with a cane. But Bruce still has limited use of his hands, and he's encouraged by Dr. Horner's work.
There's real hope that this research and this work is gonna be able to repair chronic spinal cord injuries. And first, even if I could get a little more to improve the function of my hand, that would be huge. That would be huge.
In the meantime, Dr. Horner is partnering with researchers in Spain to conduct the first large-scale safety trials combining stem cell therapy with stimulation. If successful, then human clinical trials are next.
There aren't a lot of clinical trials for people who have paralysis. Really, there are very, very few. It's usually just rehab. But I do think we're in a very short timeline to get to clinical therapy, or at least safety trial, in the next few years. So we're marching forward, I think, at a pretty fast pace.
Christopher Reeve, Bruce Hansen, and thousands of others who suffer from spinal cord injuries are inspiring researchers to find a cure for paralysis. And the University of Washington is on the cutting edge.
I'm inspired by the people that I meet who are just really living their lives and doing amazing things. We're closing in on doing something that will really change the way we think about paralysis. We really think that we're very close.
Dr. Horner and Bruce are also teaming up to try to get more state funding for spinal cord research. We commend Dr. Horner for doing what he can to help those with spinal cord injuries.